More than 44,000 patients have been affected by an IT glitch that means some of their medical data has been lost. Pathology results, vaccine uptake and read codes have been lost at around 2,500 surgeries across England. It comes at a time when resource-strapped doctors have warned they are overwhelmed by a surge in demand amid the worst winter ever. The relentless pressure they face has caused waiting times to soar, with the average wait to see a GP now being just shy of 2 weeks. But the new data loss will only add to the workload of some, amid warnings that the safety of patients will be compromised by extra work. The IT error has struck patients who have twice moved GP surgeries that operate on completely different IT systems. Date and time entries were not recorded for patients who went from a SystmOne or EMIS practice to a separate system and back to SystmOne or EMIS. The IT problem stems from an issue with importing medical records of returning patients. Pulse magazine reports the newsletter of the British Medical Association's GP Committee (GPC) states 2 other IT systems, Vision and Microdist, have been unaffected. 12 practices have had more than 100 patient records affected by the IT glitch, with 66 bits of data missing for one patient. Dr. Farah Jamil, head of the GPC, revealed that there has so far been no reported safety incidents. NHS Digital is currently reviewing the situation. It is not the first time SystmOne has come under fire. In 2016, it emerged the IT system used in around 2,500 GP surgeries miscalculated patients' risk of heart attacks. As a result, 300,000 adults may have needlessly been given statins or endured severe side effects, while others may have suffered heart attacks or strokes after wrongly being told they were at low risk. Official figures show that 41%, around 10,000 doctors, are 50 or over and are expected to quit within the next 5 to 10 years. Health Secretary Jeremy Hunt promised golden hellos of £20,000 for trainees who take up unpopular posts in October. Fewer young doctors are choosing to specialize as GPs and are opting for more macho career paths as surgeons or specialists. It came as numbers of GPs are known to be dwindling in recent years, placing even more pressure on an overstretched health service. Many are retiring in their 50s, moving abroad, or leaving to work in the private sector as practices have threatened to close their waiting lists until action is taken. This continued crisis has left many patients at risk, with staff unable to cope with the rising demand and slashed funding. The shortage of doctors comes despite the NHS adopting a plan in April to recruit 5,000 extra GPs by 2021. Mr. Hunt's pledge of £2.4 billion was said to be the answer to the staffing shortage, helping plug the growing number of vacancies. This money was devised to lure GPs to move to the worst-hit areas of England and to stop them from seeking another career. Thousands of new doctors on the cheap are also being trained to prop up the cash-strapped NHS. It emerged in June. An army of physician associates will work in GP surgeries and hospitals to diagnose patients, recommend treatments and perform minor procedures. Scores of practices also believe they are working well beyond maximum capacity, feeling pressure to take on a higher workload and risk mistakes.
Tell me where the freaks at.